Hi, everyone. Welcome to another episode of the Healthy, Wealthy, and Smart podcast. I'm your host, Stephanie Weyrauch. And today we're joined by a very special guest. Eder Garavito is here to talk to us a little bit about clinical mentorship. So I'm going to have him introduce himself and just provide a brief overview of his career. So, Eder, tell us a little bit about yourself.
Sure. Thanks, Stephanie. Myself, I'm full-time academician now. Been for about 4.5 years, give or take. I teach at the College of St. Mary's Doctor of Physical Therapy program in Omaha. We're actually a blended curriculum. We do explore technology and then the on-sites back and forth and things of the like. But before that, my true love is acute care. Cardiovascular and pulmonary specialist. Practiced at Duke Hospital for coming up on a decade now, and still PRN there. And that's sort of like my true love, the patient interaction and things of the like in the acute care setting. Um, and my story, I am guilty. It's kind of like many people's, where I busted my knee decades ago, and I ended up going to PT school as part of interest. But obviously, I don't practice in orthopedics. So I think that my story will sort of come up a little bit more as we talk about clinical mentorship here, which is what we're here to talk about. I'll leave it at that.
Yeah, so I know that that's the topic of today's podcast is clinical mentorship. And, in physical therapy, I think that we're having a lot of conversations about what is the right way to do clinical mentorship formally through residencies and fellowships, informally through jobs. Many new graduates will be attracted to a job where they'll offer clinical mentorship, or they say they will, and then they get to practicing, and maybe that isn't exactly what they it isn't exactly what was sold to them on the interview. So tell us a little bit about what inspired you to become so passionate about this topic.
Yeah, no, I mean, everything you said is literally spot on. I couldn't have said it better myself. I consider myself a product of mentorship. As I mentioned, busted my knee, ACL. I don't practice in orthopedics. I have never once in my professional life used a goniometer, right? It really all started because I had a great mentor, Don Shaw, the late Don Shaw now, who at one point was my faculty member. And I just really aspired to do the things he did and treat people the way that he treated people, and treat the patients that he knew how to treat, which ended up being the cardiovascular patients with cardiovascular or pulmonary dysfunction. So that's how I got interested in clinical mentorship, because I personally feel like until he passed away, I had such an amazing mentor and experience, and it left such a huge gap in really where I was in the season of my career as a growing clinician, when I didn't have that person to support me. But like you mentioned, Stephanie, we were promised mentorship, and usually it's this forced mentorship. We just get somebody, is given to us whether they like it or not. Are you senior PT or not? So as you mentioned, the experience isn't always what we expect it to be. So to your point, we definitely do need to, in our profession and in healthcare in general, come to a consensus and really define what mentorship should look like, right? I think the problem also that I see that you might be familiar with is that, and I see this a lot on social media, the term mentorship, I was mentored, or they're mentor me, thank you for mentoring me, is thrown out so loosely that at the end of the day, we have to just understand, one, was that education versus mentorship? Was it formal? Was it informal? And who was that mentor, and how did they mentor you and help you grow to the season in your career in which you are now in the growing journey? And I feel like not only does that need to be defined, as you mentioned, new grads get promised mentorship. Yes, you'll have mentorship for 3, 4, 5, 6 months, what have you, and the experience is completely different from what they envisioned. And my belief is that, as you mentioned, I mean, we don't have a true definition of that beyond what's in the dictionary. And I speak specifically to healthcare. So we have to define what that means, what mentorship means. And the main reason that I'm here is to help define not what mentorship is specifically, but what clinical mentorship is and what it means. And so
So,
myself, product of mentorship and my career. I can't say that I give credit to my late mentor in terms of my academic knowledge and my didactic knowledge, but definitely of who I am today as a professional.
So then how would you define mentorship, and how would you differentiate just generalized mentorship from clinical mentorship?
Yeah, sure. So I think for what I don't think the biggest thing that the biggest topic I want to touch on is exactly clinical mentorship, and that for me, for us, I should say, is what how somebody is being mentored to grow as a clinician, right, in a clinical setting. And we also have to understand that there's a difference between somebody when in a clinical rotation and they have a CI or a preceptor who really doesn't act as a mentor usually, or in my opinion, shouldn't act as a mentor, as they are looking at how well the students performing. Right, they're assessing them with one of the tools that we use to assess. They're saying they passed or they failed the rotation. Sure, giving advice and feedback throughout the whole time, but clinical mentorship should come from somebody who is dedicated to support the individual's journey and grow as a healthcare provider beyond I can perform this manipulation correctly or I did the transfer perfectly. That is part of the journey, but really growing to be an empathetic, a trustworthy, and a holistic clinician is what we believe that really helps. What we believe, excuse me, defines clinical mentorship and how we need to sort of start funneling our efforts into mentoring individuals clinically versus I'm mentoring you just as as a sort of potentially casual or in a different capacity.
So do you think that in addition to the clinical mentorship of developing those skills, developing the diagnostic tools, the ability to recognize patterns that is common with clinicians, what is your opinion on the development of professional skills? I know you had mentioned that, like in, for example, clinical education. Yes, the clinical instructor is there to teach the student how to be a physical therapist, right?
Mm.
How I've always pictured the job of a clinical instructor, and I know this is not how every physical therapist
Sure.
envisions it, is that you are mentoring that person to become a leader in physical therapy. So not only are we trying to help develop those clinical skills that you said are important, but we're also trying to help them develop those professional behaviors that are expected of a healthcare provider, advocacy for the profession, connecting with patients in an effective way, and so on and so forth. So can you give me your opinion on where you see professional behaviors lining up in the clinical mentorship model?
Yeah, absolutely. I think that potentially many healthcare providers, myself guilty for a time, argue that the formal education that you're describing, inclusive of clinical education, hands-on training, really adequately nurtures us and creates excellent healthcare professionals. And to be clear, I am not saying that that doesn't occur. It just doesn't work for everybody. So take the example that you gave me because your clinical instructor should do everything, and the term is should that you mentioned, right? But that really all comes down to chance, meaning did your clinical coordinator, education coordinator do a good job of screening that site and making sure that they're going to be good clinical educators? Did the sites coordinator ensure that the person they're matching you with is a good clinical educator or not? And unfortunately, it's almost as if your kids go to camp, when we send students out to clinical education, we have very little control over what happens in those scenarios, right? So we can't really say that every student we send out experiences what you just mentioned and grows in the way that you mentioned. But I think the biggest thing that I want to emphasize here is the fact that whether it's what we would define as general mentorship or clinical mentorship, as you just spoke about, that example that you gave of the CI helping you grow as a PT, helping you grow as a professional, helping you become empathetic, helping you refine your skills, does ultimately have the ability to grade you in one of our tools, right? The CIET, the CPI, they have the ability to communicate with your coordinators. They have the ability to communicate with your faculty. So there's a huge difference between I'm being mentored by this grandiose and amazingly intelligent clinical educator who I respect to the fullest extent of everything. But ultimately, they have control, some control, I should say, over my future, meaning they pass me or fail me. So, to that point, we need to ensure that we dissociate those experiences because a true mentorship relationship, clinical or non-clinical, should be formed by two individuals where they have no actual formal control over the person's actual progression or future. For example, if in that situation I have a great clinical educator and they come at me and they say, you know what, Eder, like you need to get X, Y, and Z together or you're not going to pass, that would be received completely different than if you, Stephanie, were my mentor and you told me, you know, you got to get X, Y, and Z together, or you're probably going to fail because there's that fear, right? There's that association with they can fail me versus Stephanie's just there to mentor me, support me, help me grow. So, my opinion and our opinion at Scholar Genetics, which is the company we're working to build this nationwide mentorship pool to really have the power of choice, is that individuals should not be formally mentored by individuals who have some sort of hold over whether they're going to progress or not progress. It's just the stakes are completely different. I'm not saying those individuals that have those controls are not good mentors or good educators, but in my opinion, at that point, that's just education because the stakes are high. If I don't perform the way they want me to, I might not pass, I might not graduate, I might not get my license. Versus Stephanie, if you're my clinical mentor, you have no stake over my future. You can tell me things differently, and I'm going to receive them differently because there's no stakes in that, right? And so bosses, leaders of individuals, faculty of students should not be assigned as mentors, or anybody or a clinician should not be clinical instructor, excuse me, should not really be a formal, I'm going to use that term, formal clinical mentor. It's more of an educational environment, if that makes sense.
Yeah, I think that those are really good points to delineate, the difference between a mentor that you need for your education versus a mentor that you need to progress as a clinician. And I do think that, you know, um, one of the limitations of our profession's clinical education is the fact that there is that power dynamic between the clinical instructor and the student, which is one of the reasons as a clinical instructor myself, I always try to decrease that power dynamic as much as I can. It's still always going to be there because you do decide, quote unquote, the fate of the student, right? Mm-hmm. But by trying to look at it as a mentee-mentor relationship versus a student-teacher relationship, I think is an important delineation in that. So you had mentioned Scholar Genetics. This is the company that basically you've started to try to help solve some of these problems that we mentioned in the beginning of the podcast. Tell us a little bit more about your company and what the job of that company is. And as my understanding is that it is a multidisciplinary company. It doesn't just focus on physical therapy. So how are you thinking about clinical mentorship in the realm of physical therapy, but then of course in other healthcare fields too?
Yeah, loaded question, but I'll simplify it. I appreciate it. So we firmly believe that mentorship, clinical mentorship itself, is not how one becomes an excellent provider, but it's the vehicle to get there, right? And as I just mentioned previously, that clinical instructor relationship where they can decide the fate is just not the same. You need to delineate I'm mentoring you versus I'm educating you. So with that said, what we're building is an infrastructure where individuals have the power of choosing their mentor, right? I've been practicing now, Stephanie, for 10 and a half years. I've never been able to just say, I want you because of whatever the reason might be, right? So we want to ensure that moving forward, we don't leave mentorship, appropriate clinical mentorship, adequate clinical mentorship, and clinical mentorship of quality to chance, meaning the generations are changing and nobody really cold calls or cold emails anymore. So what we're building is the ability for you to hop on, for anybody to hop on that is looking for some sort of mentorship into our system and provide an inquiry as detailed as I'm having difficulty understanding the relationship between the brachial plexus and XYZ, or I'm having difficulty communicating with my peers, and it's really bringing me down in my study time, etc. So based on those inquiries, we'll match you with mentors that are part of our mentorship pool nationwide, right? Palm of your hand, 24/7 in within our system. And now you're going to be the individuals are able to see one, two, or three mentors based on their individualized needs. And they're able to select them based on reviews, credentials, what the individual looks like, if they relate, right? Ethnicity is huge, and even beliefs. So what we're trying to reduce is that power. The chance of meeting a mentor that can be completely transformative to somebody's career, and offering you that from the palm of your hand, from your computer, just being able to choose who you connect with. And the thing of it is, as you mentioned when we first started the interview, sometimes we are forced into these mentorship relationships when we graduate, or you get your new job and they promise you something. I was promised things as well, academically and etc. And then the mentor who's supposed to mentor you doesn't really fulfill those needs. You can break the relationship, but where do you go from there? Here you have the power of choice. If you don't get along with the mentor for whatever reason, you can make an inquiry again. You can look for others that are going to fulfill your needs to become the best healthcare provider that you can be. Now, in terms of the multidisciplinary approach, you're completely correct. We're starting with physical therapy first, so we're focusing on that for now. Once we start breaking off into the other healthcare professionals, we of course have a plan for a lot of research to make sure that we understand what those individual professions need from clinical mentorship, because the models do differ, right?
So when you're looking for these clinical mentors, I'm assuming that you're looking at specific attributes that they possess that would be that they would be able to be funneled into your system. So tell us a little bit about what qualities do you think a good clinical mentor should possess in order to be effective in building that relationship with their
Yeah.
mentee?
Yeah, no, thank you for that question. I dare to say that I think even for myself, in the past, until I grew into who I am today and really became more sort of like versed in what makes a good mentor, is we sort of hold this belief that the individual that has the most publications, that has the most degrees, that has the most titles, that has the most courses, that has the most everything, is likely the best mentor. That I want to be that person. I want them to teach me. But in all reality, there's really no direct correlation between everything I just described and the quality of mentorship you're going to receive from that individual, right? It could be great. It could be completely horrible. And I think most of us and some of our listeners probably are thinking about situations where they were disappointed by somebody who they thought was going to be amazing, right? And so as the user within our platform, you can take all those things into consideration. You can literally request, I want somebody that has this degree. I want somebody that has an orthopedic specialty. I want somebody that's neurologically specialized. You could even request somebody that is of a specific ethnicity, or identifies a certain way. But even so, once you match and you start conversations, whether you start with, a live chat, and through the live chat, you establish that they're going to be an appropriate mentor, then you can eventually do a video call or a voice call. You can still move on to somebody else if they don't fit your needs. So to your point about what qualities are required, the biggest thing is that we need to make sure that mentors are humble, that they're patient, that they're flexible, they're understanding. And we want to make sure that the mentors, during a mentorship relationship, the mentor shouldn't be doing most of the talking. And we're not trying to transform the mentee into who we are. We're not trying to turn them into who we are. We're trying to help them become their own individual and find their own professional identity through motivational interviewing and things of the like. One of our partners for Scholar Next 360, she's actually developed a clinical mentorship certification course that we're getting approved for continuing education units and things of the like, where those who come to our platform will be able to have a free access to this course. And I'm just going to read them because I don't know them. I have them here. The pillars that her course includes: clinical identity, professional behaviors, professional drive, professional cultural belonging, and personal well-being. And so all of those facets in her course then help would certify somebody to be a clinical mentor, and therefore we believe that they would have the appropriate qualities to be a good mentor.
So it sounds like humility, patience, flexibility, those are some qualities that you mentioned that are really important for a mentor. So, I mean, a lot of those qualities that you mentioned also are important qualities in a great leader. So, you know, these ideas of leadership and being a good clinical mentor fit pretty well together. What is your advice on how mentors and mentees can form strong and effective relationships with each other? I mean, you mentioned that, you know, the mentor shouldn't be the one doing all the talking.
Right.
How can we facilitate those relationships so that they become strong?
Yeah, the first thing that I hope all the your listeners acknowledge is that the ability for a mentor to listen to a mentee um, doesn't really and receive advice from the mentee doesn't really fulfill the mentor's role completely, right? We cannot disregard the dynamics of our environment, healthcare environment, how it's changing, right? Everything's changing, and it's essential to really form these effective bonds. In my experience in my career, some of the most effective and fruitful mentorship relationships that I've been a part of or been a mentor to have, like you mentioned, mutual respect, open communication, always establish goals, right? So you need to make sure that you're able to help that mentor. So by establishing these goals from the beginning, these are my goals. This is where I want to get to. Establishing that trust in somebody, and trust is huge, right? Making sure that they understand that, of course, there are extremes, but everything that's said in that relationship, in that interaction, and within our platform, in our videos and everything, is completely confidential. So what happens often is, especially our seasoned providers, and I speak for myself, to be honest, um, it's hard to be vulnerable, right? It's hard to say, I've been practicing for 10 years. I need a mentor. It just doesn't work that way. So if we try to decrease that stigma that needing a mentor means I don't understand something, and instead I need a mentor to help me become better at something that I just learned, because textbooks and lectures and labs is pretty much how we are supposed to become great professionals, right? And by doing that and really just baking that trust with that mentor, it's almost there's almost no chance that it won't be a good relationship. But ultimately, as I mentioned, we really strongly believe in a personalized experience. So personalized experience come in two ways. You find somebody by chance, you cold call them or cold email them because somebody gave you a contact and they said they would be a great mentor to you, or you hop onto our platform and you find somebody that meets what you need. And if they don't, you just move on to the next person respectfully. And it's all about the individualized needs of that person and being heard and being seen, and how their journey grows, adapting to that journey.
You had mentioned that there are challenges within healthcare that can make the mentor-mentee relationship maybe a little bit different than other industries. What are some common challenges in these relationships, and how can they be overcome?
Yeah, so the first one I mentioned is Stephanie's vulnerability, right? It's hard for us to be vulnerable. And I'll make a generalized statement, and it's just kind of how our professions are in healthcare. But it really does have to do with the acuity of patients that we work with and such, right? So there are a lot of individuals out there that whose egos are large. They're afraid to ask for help. They feel like asking for help is weakness. And so being able to be vulnerable is huge. One of the other things that I think needs to be addressed as well is we need to, as mentors, be able to recognize and acknowledge when the mentee has outgrown us. And it does happen, right? And we see this happening in healthcare where clinicians don't refer out because they want to keep their patient for whatever reason it might be. So I know for a fact myself, and I speak for myself, I can't help every single person that comes to me for help as in terms of a mentorship relationship. I've turned some down, but I've provided them with resources because I know that I'm not the person that can help them. I've had some mentees that I've mentored for a few years, and all of a sudden, they're just completely outgrown me. So at that point, we need to be able to let go and provide them with the resources to keep going and keep flourishing and keep growing. So it comes down to adapting to the environment, right? And being able to be vulnerable, be humble, and acknowledge when it's time to, for the mentee to move on to somebody who can help them better. Again, something you can do really quickly in our platform. If we're having this conversation virtually, you can say, look, Stephanie, like I'm not the person, but I know somebody. Here you go.
Point about vulnerability. In healthcare, I think one of the things that we don't do enough is talk about our mistakes.
Mhm.
And there's a really great TED Talk where it's an emergency room physician. And this TED Talk's old. I think it's over 10 years old. But he talks about the mistakes that he's made as a physician. And if there's one thing that is really important in growing as a professional is learning from failure, right? And if
Agreed.
we're not talking about the failures that we've had as clinicians, we are missing the boat in teaching a valuable lesson. I still remember in PT school, I went to Washington University in St. Louis, and I remember Shirley Sauerman was lecturing us to one time. And Shirley, for those of you who don't know, she's a very very renowned physical therapist in the profession of physical therapy. And she told us about, one time she was treating a patient. The patient wasn't really responding to what she was doing. She left the room, and it turns out she figured out that she was passively stretching somebody who had died. And just, hearing somebody who's so prominent in the field
Right.
talk about that mistake that she made, or that realization that she wasn't being attentive. She didn't check the patient right away for vital signs, or, didn't really try to engage the patient as much. I mean, that teaches you something, and also shows you that even the greatest clinicians still make mistakes, and humanizes people. So I think that your point on vulnerability is extremely important. The next thing that I would like you to think about is just, there's this balance in mentorship, right? That we have to strike between allowing mentees to make mistakes, right? And developing that independence, but also developing their critical thinking skills. So how can mentors and mentees balance that ability to allow the mentee to make mistakes, but also helping to kind of build those skills so that they can be better clinicians?
Yeah, and that's a really good question, and I'm 100% going to answer it really quickly, but I want to just go back really quick to the mistake portion because I think it really draws light to Shirley Sarman's mistake, or any mistake about like that. It's really hard to take it to your clinical instructor because you feel like you're going to fail versus having a conversation like we're having right now, right? And that's the point I'm trying to make about you need to make sure that we have an unbiased and safe environment when we approach mentorship. Is finding the balance between letting the mentee fly on their own and being able to teach them all comes down to your own assessment as a mentor, being able to have these conversations with the individuals, and just understanding that even though some argue that mentorship sort of remains static, and has many limitations, it all is ultimately adaptable, and it's adaptable to the individual's needs. And as long as there's open communication, I think that's one of the most important facets.